Have you ever wondered what simple health tests might literally add years to your life after 60? I'm talking about screenings so vital that missing them could be the difference between catching a serious condition early, when it's treatable, or discovering it too late. I'm Dr. Castle Conley, and today we're discussing something that could save your life or the life of someone you love. Let me share something personal with you. My father always considered himself healthy, active, relatively fit, rarely sick. At 67, he hadn't visited a doctor in nearly 5 years. "Why bother when I feel fine?" he'd say. It wasn't until my sister convinced him to get a routine checkup that doctors discovered early-stage colorectal cancer. Because they caught it early, his treatment was successful. Today, at 78, he's still enjoying his morning walks and playing with his grandchildren. But this story could have had a very different ending. Did you know that adults over 65 who get recommended preventive screenings have a 25% lower mortality rate than those who don't? Yet nearly 40% of seniors skip at least one crucial health test each year. The reality is that many serious health conditions develop silently, with symptoms appearing only in advanced stages. By then, treatment options may be limited, more invasive, and less effective. Throughout this video, I'll walk you through the 3 absolutely essential health tests everyone over 60 should never skip. We'll explore exactly what these tests involve, how frequently you should get them, what the results might mean, and, most importantly, how they can save your life. I'll also share practical advice for scheduling these screenings, navigating insurance coverage, and talking effectively with your healthcare providers. Your health is your most valuable asset. These next 15 minutes could be the most important investment you make in protecting it. Let's begin. Let's talk about our first critical health test: comprehensive cardiovascular screening. Heart disease remains the #1 killer of adults over 60, claiming more lives than all forms of cancer combined. What makes cardiovascular disease particularly dangerous is that it often develops silently for decades before causing noticeable symptoms. By age 60, the cumulative effects of blood pressure, cholesterol, and other factors can significantly increase your risk. Your cardiovascular system, your heart and blood vessels, is like the highway system of your body. When this system starts to fail, everything downstream is affected. The good news? With proper screening, we can identify problems early and take action before a serious event like a heart attack or stroke occurs. A comprehensive cardiovascular screening isn't just one test. It's a series of assessments that together paint a complete picture of your heart health. The first component is blood pressure monitoring. Your blood pressure numbers tell an important story. They reveal how hard your heart is working to pump blood and how much resistance it's facing in your arteries. After 60, you should have your blood pressure checked at least once every 6 months, even if previous readings were normal. If you have a history of hypertension or other risk factors, your doctor might recommend more frequent checks or even home monitoring. The second vital component is a complete cholesterol panel. This blood test measures several types of fat in your blood, including LDL, often called bad cholesterol, HDL, good cholesterol, and triglycerides. These numbers help predict your risk of developing plaque buildup in your arteries. After 60, you should get a complete lipid panel at least once a year. What many people don't realize is that cholesterol guidelines have changed over the years. Today, doctors look beyond just total cholesterol to examine the ratio between different types and consider other risk factors. The third key component is an electrocardiogram, or ECG. This painless test records the electrical activity of your heart to detect irregularities in rhythm and signs of heart damage. Many doctors recommend a baseline ECG for all adults over 60, with follow-up tests every 2 to 3 years if results are normal. If you have known heart issues or symptoms, annual ECGs may be recommended. For higher-risk individuals, additional tests might include an echocardiogram, an ultrasound of your heart, stress tests, or coronary calcium scans. These provide more detailed information about your heart's structure and function. Now, what warning signs should prompt an immediate cardiovascular checkup? Chest pain or pressure is the most obvious, but did you know that symptoms often present differently in older adults? Watch for unusual fatigue, shortness of breath with normal activities, dizziness, irregular heartbeats, swelling in your ankles or feet, or decreased exercise capacity. Women, in particular, may experience subtler symptoms like nausea, back or jaw pain, rather than classic chest pain. Let me tell you about Martha, a 72-year-old viewer who wrote to me last year. Martha had been experiencing unusual fatigue for months but attributed it to just getting older. During a routine checkup, her doctor noticed her blood pressure was significantly higher than her previous readings and ordered an ECG. The results showed silent ischemia, reduced blood flow to her heart without the typical chest pain. Further testing revealed a 90% blockage in one of her coronary arteries. Martha received a stent and later told me, "I had no idea my tiredness was my heart crying for help. That screening saved my life." Another viewer, Richard, age 68, had a completely normal blood pressure at his doctor's office but mentioned occasional dizziness when standing up. His doctor recommended home monitoring, which revealed significant drops in his blood pressure when changing positions. This condition, called orthostatic hypotension, was putting him at risk for falls and wasn't detected during his office visits. With medication adjustments, Richard's symptoms improved dramatically. I cannot overemphasize this point. Cardiovascular disease can be effectively managed or even prevented when caught early. The screenings I've described are non-invasive, relatively inexpensive, and widely available. They represent your first line of defense against the leading cause of death for people over 60. Make the call today to schedule these tests. Your heart will thank you for years to come. The second critical health test everyone over 60 should prioritize is regular cancer screening. Cancer risk increases significantly with age. In fact, 60% of all cancers are diagnosed in people 65 and older. But here's the empowering news. When detected early, many cancers have survival rates of 90% or higher. The key is finding them before they've had a chance to spread. Let's begin with colorectal cancer screening, which is absolutely essential after age 60. Despite being highly preventable, colorectal cancer remains the second leading cause of cancer deaths among older adults. The gold standard screening is a colonoscopy, which allows doctors to not only detect cancer but also remove precancerous polyps before they become dangerous. Current guidelines recommend colonoscopy every 10 years for average-risk adults aged 45-75, though your doctor may recommend more frequent screening based on your personal risk factors. For those who are reluctant to undergo a colonoscopy, there are alternative screening options like stool-based tests, including the FIT test, fecal immunochemical test, which can be done annually at home. However, these alternatives aren't as thorough as colonoscopy, and a positive result will still require follow-up with a colonoscopy. Don't let embarrassment or discomfort prevent you from this life-saving test. Modern procedures are much more comfortable than in the past, and the preparation has improved significantly. For women over 60, breast cancer screening remains crucial. The American Cancer Society recommends annual or biennial mammograms for women up to age 74, though some experts suggest continuing beyond this age, depending on overall health and life expectancy. 3D mammography, tomosynthesis, is now becoming more widely available and can provide more accurate results, particularly for women with dense breast tissue. Remember, 20% of breast cancers occur in women over 70, so don't assume you've aged out of needing these screenings. For men, prostate cancer screening decisions should be made through informed discussions with your doctor. The PSA, prostate-specific antigen blood test, can detect prostate cancer early, but it has limitations including false positives that can lead to unnecessary procedures. Current guidelines suggest PSA screening should be an individual decision for men between 55 and 69. For men over 70, screening recommendations vary based on health status and life expectancy. What's most important is having an honest conversation with your doctor about your specific risk factors, family history, and preferences. One often overlooked screening that's vital for everyone over 60 is a comprehensive skin examination. Skin cancers are the most common malignancies in older adults, with rates tripling in those over 65. An annual full-body skin check by a dermatologist can identify suspicious moles or lesions before they become problematic. Between professional exams, perform monthly self-checks using the ABCDE rule. Look for asymmetry, irregular borders, uneven color, diameter larger than a pencil eraser, and evolution, or changes in existing moles. Now, let me address some common misconceptions about cancer screening. First, many people believe that if they have no symptoms or family history, they don't need screening. This is dangerously incorrect. Most early-stage cancers produce no symptoms, and the majority occur in people with no family history. Second, some worry that radiation from mammograms or other imaging tests might cause cancer. The reality is that the minimal radiation exposure from these tests is far outweighed by their potential to save lives through early detection. The science behind early detection is compelling. Take lung cancer, which has traditionally had poor outcomes. When caught at stage I, the 5-year survival rate is around 60–80%. But by stage I, that drops to less than 10%. This dramatic difference is why low-dose CT screening is now recommended for long-term smokers and former smokers who quit within the past 15 years. Let me share Barbara's story, a 67-year-old who had been putting off her mammogram just for a few months that turned into 2 years. When she finally went, doctors found a small tumor that required surgery but fortunately hadn't spread to her lymph nodes. Her oncologist told her that had she waited another year, her prognosis would likely have been much worse. Today, 5 years later, she remains cancer-free and has become an advocate for regular screening in her community. James, a 73-year-old retired teacher, had always been healthy and saw no need for a colonoscopy. His daughter finally convinced him to get screened, and doctors found and removed several precancerous polyps that would almost certainly have developed into cancer within a few years. Now James schedules his follow-up screenings without prompting. These screenings aren't just medical procedures, they're acts of self-care and responsibility. They represent your commitment to your future self and to those who love you. Don't wait for symptoms to appear. By then, cancer is often more advanced and treatment more difficult. Make these screenings a non-negotiable part of your healthcare routine. Our third essential health test after 60, and one that's frequently overlooked, focuses on your bone health and fall risk assessment. While not as immediately life-threatening as heart disease or cancer, bone health has profound implications for your independence, mobility, and overall quality of life as you age. Let's start with some sobering statistics. 1 in 4 people over 65 falls each year, and falls are the leading cause of fatal and non-fatal injuries in older adults. Even more concerning, 1 in 3 adults over 50 will experience an osteoporotic fracture in their lifetime. A hip fracture after 60 carries a 20% mortality rate within the first year, not because the fracture itself is fatal, but because of complications and the downward health spiral that often follows. The cornerstone of bone health assessment is the DEXA scan, that's dual energy X-ray absorptiometry. This painless, non-invasive test measures your bone mineral density and is the gold standard for diagnosing osteoporosis and assessing fracture risk. During a DEXA scan, you simply lie on a padded table while a scanner passes over your body, typically focusing on the spine and hips where osteoporotic fractures are most common. The entire process takes just 10–15 minutes and exposes you to significantly less radiation than a standard chest X-ray. So when should you get a DEXA scan? For women, the recommendation is to have a baseline scan at age 65. Men should typically have their first scan at 70 unless they have risk factors that warrant earlier screening. These risk factors include a family history of osteoporosis, long-term steroid use, certain medical conditions like rheumatoid arthritis or celiac disease, and history of smoking or excessive alcohol consumption. After your baseline scan, your doctor will recommend follow-up intervals based on your results, typically every 2–5 years. Your DEXA results are reported as T-scores, which compare your bone density to that of a healthy young adult. A T-score above -1 is considered normal. Between -1 and -2.5 indicates osteopenia, or lower than nominal bone density. A score below 2.5 means osteoporosis is present. Each standard deviation below normal approximately doubles your fracture risk. What many people don't realize is that bone health isn't static, it's dynamic. Your skeleton completely regenerates itself about every 10 years through a process of constant breakdown and rebuilding. As we age, especially after 60, the breakdown tends to outpace the rebuilding, resulting in progressive bone loss. The good news is that with proper intervention, this process can be slowed or even reversed in some cases. Equally important to the DEXA scan is a comprehensive fall risk assessment. This multifaceted evaluation examines factors beyond bone density that contribute to fall risk. Components typically include 1. Balance testing. Simple assessments like the timed up and go test, where you rise from a chair, walk a short distance, and return to sitting, can reveal subtle balance issues. 2. Vision screening. Visual impairments significantly increase fall risk and are often easily correctable. 3. Medication review. Many common medications can cause dizziness, particularly when combined with others. 4. Home safety evaluation. Identifying hazards in your living environment that increase fall risk. 5. Strength and gait assessment, evaluating muscle strength and walking patterns for instability. Eleanor, a 79-year-old former nurse, credits these assessments with maintaining her independence. After her DEXA scan revealed early osteoporosis, she began weight-bearing exercises, calcium supplements, and eventually medication therapy. My doctor also noticed I was hesitant when turning during my walk test, she told me. It turned out my bifocals were creating visual distortion when I looked down. Switching to progressive lenses made an immediate difference in my confidence while walking. Another viewer, Robert, age 71, discovered through his assessment that the blood pressure medication he took at bedtime was causing nighttime dizziness, increasing his risk of falls during bathroom trips. Simply changing when he took his medication eliminated this risk. Based on your bone density and fall risk results, your healthcare provider can recommend specific preventative measures. These might include 1. Medication therapy if osteoporosis is present. Several effective options can significantly reduce fracture risk. 2. Nutrition modifications. Ensuring adequate calcium and vitamin D intake is essential for bone health. 3. Exercise prescription. Weight-bearing and resistance exercises are proven to build bone density and improve balance. 4. Balance training. Specialized exercises that improve proprioception and stability. 5. Home modifications. Simple changes like installing grab bars, improving lighting, and removing trip hazards can dramatically reduce fall risk. 6. Vision correction. Ensuring your glasses prescription is current and appropriate for different activities. 7. Vitamin D supplementation. Most adults over 60 benefit from vitamin D supplements, which improve both bone health and muscle function. The link between bone health and overall mobility cannot be overstated. Strong bones and good balance allow you to stay active, and staying active helps maintain bone density. It's a virtuous cycle that supports overall health. Conversely, fear of falling can lead to reduced activity, which accelerates bone and muscle loss, creating a dangerous downward spiral. I urge you not to underestimate the importance of these assessments. They provide crucial information that allows you to take control of your bone health and independence before a devastating fracture occurs. Remember, the goal isn't just adding years to your life. It's adding life to your years by maintaining mobility and independence. Now that we've covered these 3 essential health tests, let's talk about how to actually get them done. Because knowing what you need is only half the battle. The other half is navigating the healthcare system to make it happen. First, how to talk effectively with your doctor. Come prepared to your appointments with a written list of your concerns and questions. Be direct about wanting these specific screenings. I'd like to discuss getting a comprehensive cardiovascular assessment, or it's been several years since my last bone density scan and I'd like to schedule one. If your doctor seems dismissive or doesn't address your screening requests, be persistent. Say something like, "I understand you're busy, but these screenings are important to me. Can we discuss the options today?" Remember, you are your own best advocate. Regarding insurance coverage, The good news is that Medicare Part B covers many preventive screenings with little or no out-of-pocket cost. This includes cardiovascular screening, blood tests every 5 years, annual mammograms, colonoscopies, frequency depends on risk factors, and bone density tests every 24 months for those at risk. Many Medicare Advantage plans offer additional coverage for preventive services. If you have private insurance, preventive screenings are typically covered under the Affordable Care Act, though coverage details may vary. For those facing barriers to testing, consider these solutions. If transportation is an issue, many communities offer senior transportation services, and some Medicare Advantage plans now include transportation benefits. If cost is a concern, ask about payment plans or reduced fee programs. Community health centers and hospital outreach programs often provide screenings at reduced costs. And if fear or anxiety is holding you back, be honest with your healthcare provider about these feelings. They can often suggest approaches to make the experience less stressful. Keeping track of your health records is crucial, especially as we age and often see multiple specialists. Create a simple health journal or digital record that includes dates and results of all screenings and tests, current medications and dosages, questions that arise between appointments, symptoms you experience, even if they seem minor. Many healthcare systems now offer patient portals where you can access your test results and communicate with your healthcare team. These tools can be invaluable for staying on top of your screening schedule and following up on results. Remember, scheduling and completing these tests is an act of self-care. It's not about finding problems, it's about gaining knowledge that empowers you to take control of your health. We've covered so much ground today, and I hope you now understand why these 3 health tests are absolutely non-negotiable after age 60. Let's quickly recap. Comprehensive cardiovascular screening, including blood pressure monitoring, cholesterol panels, and ECGs, can detect heart issues before they become life-threatening. Cancer screenings, particularly colorectal, breast, prostate, and skin exams, can identify cancers when they're most treatable. And bone density testing with fall risk assessment can preserve your mobility and independence for years to come. The power to protect your health lies in your hands. These screenings aren't just medical procedures, they're investments in your future. They're your opportunity to catch potential problems early when treatment options are most effective and least invasive. I'm asking you today to make a commitment to yourself. Pick up the phone, open your calendar, and schedule at least one of these screenings in the next week. Don't wait for symptoms to appear or for someone else to remind you. Your health deserves to be a priority. If you found this information valuable, please subscribe to our channel and hit the notification bell so you don't miss our upcoming videos on navigating healthcare after 60. Next week, we'll be discussing the 5 essential supplements most seniors are missing and how they impact your energy, cognition, and overall vitality. I'd love to hear about your experiences with these screenings in the comments below. Has early detection made a difference in your life? Do you have questions about any of these tests? This community grows stronger when we share our stories and support one another. Remember, aging well isn't about luck, it's about making informed choices. These 3 tests could literally save your life. Thank you for watching, and I'll see you in our next video.